So when we talk about the upper limb, we're in the appendicular skeleton, right? Appendicular meaning appendage. Appendage meaning something that's stuck on the end of or stuck onto. So the limbs are stuck onto the axis. Okay, and so the limbs are stuck onto the axis, appendicular skeleton, and we have two girdles or circles of bone that attach to the axis, and then the limbs attach to these girdles or circles of bone. When we talk about the upper limb, we think of the arm as the whole appendage, right? We think of the arm as the whole appendage, but anatomically this term is more limited, and it refers only to the portion of the upper limb from the shoulder to the elbow joint. So we're only talking about the humerus, okay? So the portion from the elbow to the wrist is called the forearm, and the portion including the wrist is called the hand. Upper limb contains 30 bones. Most of those are obviously in the hand. Unfortunately for you, most of those are carpal bones, or metacarpal and phalanges, and they have the same names. Okay, so you have a diagram on one of the following pages of what we're talking about. We've got the humerus here, and that's the bone that we're going to be talking about first. So as we go through this, we'll just we'll fill in our notes here first, and then we'll do some labeling. So arm extends from shoulder to the elbow joint. What did we call the shoulder joint? We don't really want to call it the shoulder joint. Yeah.
Acromion process?
Okay, so the acromion process is on the scapula, right? But it articulates with the clavicle, so that's the acromioclavicular joint. What do we call the cup? You just did a quiz that had the joint cavity of the scapula on it. What do we call that? Yeah.
She didn't get the packet over.
Okay. So what do we call that?
So,
Call it the glenoid or glenoid cavity, right? Okay, that was on the quiz you just took. Did you all miss it? Or you just didn't want to say it? Does anyone else need this packet? Anyone else need this packet? Emily, and you do.
Do the study guide?
Huh?
Do the study guide?
No, did you not get the study guide?
No, I didn't.
Okay. No, this is the upper limb packet that we're working on right now. You have the
Okay.
Okay. So is it that we just didn't remember it even though we just took a quiz over it, that it was the glenoid cavity? Right, that fossa that the humerus sticks into, the cup of the joint, right? Right here is the glenoid fossa. So the shoulder joint, since it connects the glenoid fossa to the humerus, should be called the what joint? Glenohumeral. Okay, I need you to know these things, guys. It consists of only a single bone. The arm is the humerus. Okay. Proximal articulation consists of a rounded head. We're going to call that head that fits into the glenoid fossa, the glenoid cavity of the scapula, as can be seen in both diagrams, a distinct line of separation from the rest of the bone is present at the base of the head. And I'll just go back and forth here. We can see this line right here, right? We can see the line of separation there. Okay, so this is going to be the head. This is going to be the anatomical neck. Or just the neck. Okay, so that's going to be the neck. Okay, so anatomical neck or neck. Okay. Immediately distal to the neck on the lateral and anterior surfaces are three important bone markings. Okay, if I look at this surface here, this is the anterior surface, and I can see this rounded chunk of bone here, this rounded mound of bone here, and I can see another one right here, and these are called processes. So sometimes rounded humps of bone like this are going to be called processes, and they're usually present to provide muscle attachments. So we'll find out that there are muscles that are going to be attached to these things, and obviously we're going to have to give them a name. And so we're going to call the greater one, and actually we're not going to use the term process here. We're going to use a different term. I don't know where my mind was. We're going to use a term that also means a rounded process of bone, but it's a different term. We're going to use the term tubercle. Okay? So this greater one here we're going to call the greater tubercle, and I'll explain that term here in just a second. Greater tubercle, 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 greater tubercle, and then we're going to call the littler one the lesser tubercle. And then there's a groove in between here, okay? And this is a fairly important groove anatomically. Several muscles are going to attach inside this groove here to help move the arm. And we're going to call this, since it's between the tubercles, the term that we use for in between something is inter. So it's going to be called the intertubercular groove. Okay, the intertubercular groove. INTERTUBER, tubercular, CULAR, groove. The groove between the tubercles. The groove between the tubercles. Okay, so we've got the head, the neck, the greater tubercle, the lesser tubercle, and the intertubercular groove. And these three things here are going to be important sites of attachment for muscles. So we need to go back and put these in our notes here. So immediately distal to the neck on the lateral and anterior surfaces are three important bone markings. In some circumstances, raised, rounded projections of bones have been called processes. Here we encounter a new term for a similar feature, tubercle. This is our new term, tubercle. Okay, and what does the term tubercle sound like to you?
Tuberculosis.
Tuberculosis. Where do I have tuberculosis? In my lungs, right? So tuberculosis is an infection of the lung, or it can infect the rest of the body as well. But the pathology of tuberculosis is that the immune system attacks this, and when the immune system attacks this bacteria in the lung, it creates little masses, okay? And it forms little masses throughout the lung that the early anatomists called tubercles. Okay, so the term tubercle actually means little mass. So my lungs became full of these little masses that weren't cancerous, they were just reactions to the tuberculosis bacteria. And this is a fairly severe disease, or a serious disease. Most of us won't get it, even if we're exposed to it, because it's usually a disease that we see in immunocompromised patients, AIDS patients, transplant patients, people on immunosuppressive drugs oftentimes get tuberculosis. In fact, it's actually a common thing in TV commercials for a lot of these new drugs. A lot of the new cancer-killing drugs, or a lot of the drugs that treat autoimmune diseases. See, I'm trying to think of the Sclerosis, the ones that treat the disease that you get the patchy skin rashes. Well, eczema is just a general term for skin irritation. What's the severe one, the autoimmune one? What am I thinking of? Huh? Anyway, multiple sclerosis, we have some drugs that treat that. We have all of these drugs, if you pay attention when one of these drug commercials on, come on, listen to it, pay attention to it, and the last three letters of the names of the drug will be MAB. So there's one that's called adalimumab, and MAB is the last three letters of it. And these three letters mean monoclonal antibody. Monoclonal antibody. And the word monoclonal antibody means that this drug attacks the immune system. Since we have these autoimmune diseases, Phil Mickelson advertises psoriasis. That's what I was thinking. So psoriatic arthritis, psoriasis. Phil Mickelson advertises one of these, and I forget what the drug name is. But the name of the drug, not the drug company name, but the actual name, the generic name, has the last three letters MAB, which means monoclonal antibody, and that means that it attacks the immune system. And that's what we do with these autoimmune diseases. We attack the immune system, and we make the immune system so that it's not as effective. And in every single one of these, it'll say, tell your doctor if you've had tuberculosis. Tuberculosis can come back. Tell your doctor if you've had tuberculosis. Do not take Sclerosis if you've had tuberculosis. Okay? And that's what happens. The immune system in most of us is strong enough that it doesn't really, we don't really get tuberculosis. But if I have immunocompromised patients, it's very easy for them to get tuberculosis. Anyway, long story. So we encounter a new name for a similar feature. So we're using the term tubercle as an anatomic term here. It's a term that means small swelling. Okay? And there are two of these. The larger and more lateral one is the greater tubercle, as we've already said and labeled. Greater tubercle. While the more anterior and inferior one is the lesser tubercle. And as you would guess, both are sites of muscle attachments. In between, we have the intertubercular groove. And a tendon of the biceps muscle runs through that groove. And so this is from the Latin word tuberculum, meaning a small swelling. Okay? So I spent way too much time telling you about the meaning of the word tubercle. But you learned something about immune diseases in the process. So pay attention to those drug commercials and see if you can't identify the term MAB. And in fact, here's what I'll do. If you can write down the name of some of those drugs you see on commercials, write down the generic name, one of those names that has MAB in it, I'll give you a point or two of extra credit for something, okay? So just think about it. The shaft of the humerus is relatively featureless, displaying only two major markings at the midpoint. Laterally, over here on the outside, right here. Right here I have, hang on, where my line is not thick enough, right here. Okay, right there. That's going to be called the deltoid. And now I've got a new term, not tubercle, but I'm going to call this the deltoid tuberosity. Okay, so I've got tubercles and tuberosities. They're basically the same thing. Okay, if you're using your phone right now, I'd appreciate it if you put it away. Okay, so deltoid tuberosity. Okay, and then on the other side, I've got a little groove here. And we're going to call this the radial groove. Right here, you can see this little groove right here on that drawing. It's barely noticeable. It's the radial groove. And anytime I have a little groove or something that goes across a bone like that, it's mainly for a path of a nerve. So there's a nerve that goes over that little groove there. And what would you guess the name of that nerve is? The radial nerve, okay? Which bone in your forearm is your radius? If I'm standing in the anatomic position, is it the medial one or the lateral one? It's the lateral one, right? Because that's where I feel my pulse. And my pulse is the radial artery. Okay? So the radial nerve, this is the nerve that goes to your radius and feeds the skin over your radius. On the other side, you've got a nerve that runs, that you call your funny bone, that runs over your elbow. Right there, you can roll it underneath of your fingers. That's going to be the nerve to the other bone. What's the other bone in your forearm? The ulna. So that's going to be your ulnar nerve. Okay, so I've got my ulnar nerve that runs right through the area of my funny bone there. That's going to go to the inside, and I've got the radial nerve that's going to go to my tissue around my radius. Okay? So just some additional information there. So, again, laterally is a small process of bone called the deltoid tuberosity. What muscle do you think is going to hook into the deltoid tuberosity? The deltoid muscle, right? Okay, and that makes sense, right? My deltoid muscle is going to make my arm do this. So you would think that it's going to attach laterally on my humerus, on the outside of my humerus, right? So my deltoid muscle makes me do that. It also makes me do that, but my deltoid muscle is going to raise my arm. As its name states, it's point of insertion for the deltoid muscle, which should make sense given the function of the deltoid muscle to flex the arm at the shoulder and to abduct the arm. The other marking was called the radial groove, right? And so we label and put the names in our notes so that we get some repetition there. Okay, now the complex part of the humerus is the distal part of the humerus because we've got a lot going on there. At the proximal end of the humerus, we just have the head that fits into the scapula, right? That's all that happens there. But at the other end of this, the distal end of the humerus, we have a lot of articulation happening. Okay, at the distal end of the humerus, I've got all of this stuff right here from my forearm that needs to attach to my humerus. Okay, I've got all of this stuff from my forearm that needs to attach to my humerus. And the distal end of my humerus looks pretty complex. Okay, so we've got several things that we need to think about here at the distal end of the humerus. First of all, you can feel these 2 points of bone, right? I can hold my arm like this, and you can feel those 2 points of bone at the distal end of your humerus. There's one right here, and there's one on the other side. Okay, and if I go to my arm right here, here's the one on the medial side, and here's the one on the lateral side, right? So I can feel these 2 points of bone. And when I have a point of bone that's going like this, it's going to be an attachment for a set of muscles where I've got this expansion of the bone like this. This is called an epicondyle. Okay? So I've got a medial epicondyle and I've got a lateral epicondyle, and these are a site of attachment for my forearm muscles. Okay? And you can tell which ones are which. If I hold my hand across like this and I flex my forearm, do I feel muscles contracting on my lateral side or on my medial side?
I feel it right here.
Okay? You feel it on the lateral side, right? Okay? So when I flex my forearm, is that where you feel those? You feel both? Where's the major part of that going to occur? Okay? Go the other way, extend your wrist. Where do you feel that? Laterally or medially? It's laterally, right? So the medial epicondyle is the site of all of your forearm extensors, or I'm sorry, my flexors. So when I flex my forearm, all of these muscles are going to cover my forearm and flex my wrist and my fingers. Okay? And when I do that, I can see the muscles flexing, right, on this side. When I extend, I can see the other side muscles and feel the other side muscles flexing, right? So my lateral epicondyle is going to start or be the site of origin for all my extensors. Okay? And that's how we'll know where these muscles are going to start. All of the flexor muscles are on the medial part. All of the extensor muscles are going to be lateral. Now, how am I going to tell which side is medial and lateral when I look at the humerus? How am I going to know which of this, that this is lateral and this is medial? Just by what other part of the humerus is going to help me figure that out? The head. Yeah, the head is always going to be medial, right? So whichever epicondyle is on the same side as the head of the humerus, that's going to be the medial, and the one opposite, that's going to be the lateral. Okay, so I have the medial epicondyle, E-P-I-C-O-N-D-Y-L-E, medial epicondyle, and then I've got the lateral epicondyle. Okay, so there's the medial epicondyle and the lateral epicondyle. And we'll talk more about what a condyle is because this is a two-part word, right? Epi means next to the condyle. So this is next to the condyle. Unfortunately, in our humerus, we don't actually have condyles. And when we talk about the femur and the tibia and that articulation, we'll talk about condyles as well as epicondyles. But epicondyles are things that are sites of muscle attachment. Condyles are surfaces that connect with other bones. And we don't have condyles here. Okay, now, we've got something else going on here. If you look at the proximal end of the ulna, and we're not learning about the ulna and the radius yet, but if you look at the proximal end of the ulna, you've got a chunk of bone that sticks up above the ulna here, and it's like a hinge. Okay? And if I look at it, it's like this, right? It's like this. I've got, if I do that, I can put my hand over that, and it's got like my cupped hand. There's a little piece that sticks out here called the coronoid process, and this big chunk of bone that sticks up above there called the olecranon process. And this is the hinge that hinges around the distal end of the humerus. So right here, this thing reminded the early anatomists of a pulley. Okay, I'm sure you've seen a pulley where it's got a little track in the center of it where a rope can go through there, right? So a rope is going to go through there. And this kind of reminded the early anatomists of a pulley. So they called this chunk of bone right here at the distal end the trochlea, because trochlea means pulley. Okay, trochlea means pulley, and that's the part that my hinge is going to swing around. So right here is the trochlea, and right here is the olecranon process that swings around that pulley. And you can see that it literally is a kind of a C-shaped structure that hinges around the trochlea. So if I look at that from the side, it almost looks like kind of a wrench. Okay, so the olecranon process looks like, oops, didn't want to do that. The olecranon process looks like this wrench here, and it swings around the trochlea. Okay? And that's what forms my elbow joint. Okay, that's going to be my elbow joint as the olecranon process hinges around this. Okay? So it hinges around it, and this is the back side of the humerus. This is the anterior surface of the humerus, and this part of the hinge gets stuck in this little indentation in the bone right here. Okay? So this gets stuck in this little depression in the bone here, and we call this depression in the bone the Olecranon Fossa. Okay? It's a depression in the bone. A depression in a bone is called a fossa, and this part of the olecranon process gets stuck in that. What do you think that prevents my elbow from doing? I can't hyperextend my elbow, can I? I can't go any further because this thing gets stuck here. Okay? It is really, really, really hard to dislocate your elbow. It's possible, but it causes so much damage if you dislocate your elbow from this or hyperextend your elbow that those can be career-ending injuries for athletes. To dislocate your elbow destroys a lot of tissue. Okay? I only want my forearm to be able to do this. Okay? I only want my forearm to be able to flex and extend. I don't want it to be able to go off to the side. I can rotate my arm, but I can't rotate my humerus or my forearm against my humerus here. It's stuck. I can only do this or this. I can only flex or extend it. And this is what causes that to happen. This being stuck around this, I can't do anything other than flex or extend. Okay? But I would like my forearm to be able to do something else. I would like my forearm to be able to rotate, right? If I hold my upper arm steady, I can rotate my forearm. But it's not because of this, it's because of the other bone that's going to attach to the humerus, and this is the radius right here. And it's called the radius because it rotates. Okay? Look at this top of this radius right here, the head of the radius. It's like a disc. It rotates around. Okay? And so this disc can rotate, and that rotates my forearm like this. So that's on the outside. See what my radius can do. It can rotate my hand around the ulna. Okay, so the ulna's on the inside, the radius is on the outside. And the only purpose for the radius is so that I can rotate my forearm. But it articulates with the humerus on the outside part, or the lateral part. So if I go over here, here's where the radius articulates. The ulna articulates here, the radius articulates here. And the early anatomists, who knows what they were smoking at the time, but the early anatomists thought that this reminded them of a skull. Okay? The rounded nature of this reminded them of a skull. And the word for head, the Latin word for head, is caput. Okay? So this thing is called the capitulum. Okay, this part of the distal end of the humerus is called the capitulum, and not caput, but caput is the word that it comes from. This part is called the trochlea because it reminded them of a pulley, medial epicondyle, lateral epicondyle. And you'll notice there are two depressions here at this end of the humerus as well. This is on the back side or the posterior surface, the Olecranon Fossa. So maybe this thing fits into a depression on the front side of the humerus. Okay? This is called the coronoid process because it reminded the anatomist of a crown. The way that this looks, this process looks, it reminded them of a crown around the top of the bone here. And so they called it the coronoid process. Corona means crown. Okay? And so the coronoid process is going to fit in anteriorly to the coronoid fossa. And the radius, the head of the radius, is going to fit into this other depression over here, and that's going to be called the radial fossa. Okay, so here's the radial fossa, here's the coronoid fossa, here's the capitulum right here, here's the trochlea, lateral epicondyle, medial epicondyle. Okay, and then on the other side, the back side, this is going to be the Olecranon Fossa, where this part of the ulna fits into that. Okay, and so you can kind of see, once you know all of this, how structure here reflects function. This is called a hinge joint, and you can see why it's called a hinge joint. It acts like a hinge, right? This thing wraps around this trochlea structure here, and posteriorly and anteriorly, and allows us to flex and extend, whereas this part articulates with the head of the radius. Okay, so here's the head of the radius. This part right here articulates with that, and this swivels back and forth. Okay, and so this is going to be called a pivot joint right here. This is a pivot joint because that's going to allow it to pivot around the radius. Okay, so hopefully we've got enough information to go back in and fill in some blanks. So at the distal end of the humerus is a large number of markings. We had a whole bunch of them, didn't we? Some are used for muscle attachments, others for articulation. Remember that we said articulation is where the bones communicate. That's what it means to articulate something, is to communicate, right? So this is where the bones are articulating or communicating. That is at the joints. So at the distal end of the humerus, as it's approached, two large expansions of bone laterally and medially are the lateral and medial what? Epicondyles. Lateral and medial epicondyles. A condyle, actually, I guess I am going to explain this here. A condyle is typically an expansion of bone used as an articular surface. An epicondyle is an expansion of bone adjacent to a condyle used for muscle attachment. So these attachments, or these extensions, are used for muscle attachments, mainly those that will move the hand and the wrist. We explained all that. The remainder of the markings are for articulation with the bones of the forearm, the radius, and the ulna. If we look posteriorly and notice the deep depression in the distal humerus between the two epicondyles, and then we look at the smaller. Yeah.
Are you using them right now?
No, you can take it back. I'm sorry.
We're going to do a TikTok.
Oh, are you? Cool.
We'll start with you.
Well, maybe we'll make one too. And we'll compete with you.
Oh, it's always a competition.
It is, right?
It is.
I'll leave that up to you guys. She shouldn't have told us that. So you can make one too if you want. So anyway, if we look posteriorly, we notice the deep depression in the distal humerus between the two epicondyles. Then look at the smaller diagram of the radius and the ulna. Notice the superior prominence of the ulna. We call that the Olecranon process. And we said it had a curved surface that looks like it could swivel around a cylinder. The Olecranon process articulates with the trochlea, right? The Olecranon process fits into the posterior depression of the humerus, and we called that the Olecranon Fossa. And it prevents the elbow from hyperextending. Now look anteriorly and notice the cylindrical structure inferiorly around which the Olecranon process articulates. Laterally, we had the more rounded knob of bone, and we called that the capitulum. That was lateral, right? The capitulum. The medial prominence of this structure is called the trochlea. And we explained all that. And then just superior to this are two shallow depressions in the humerus. Okay? And we said one was for the head of the radius. That's going to be called the radial fossa. One was for the coronoid process, not to be confused with the coracoid process of the scapula. So these two prominences of bone would fit nicely into the depressions of the humerus. We called these the radial fossa and the coronoid fossa. And these allow the forearm to flex at the elbow as fully as possible. If I flexed and I didn't have these fossa, my coronoid process and my radial head would get stuck. They would get stuck and I couldn't go any further if I didn't have those fossa. Okay? So I have also given you a diagram of these features of the humerus, and that will be your question of the day next time.
Yes.
Okay? And I will give you the diagrams with the letters, and I will mix the terms up just like I did on the one today, and you'll have to put the correct terms or the correct letters in the match them with the correct terms. Again, if you've already done this one in medical forensics, you won't have to do this again. Although you will have to do it on the bone test. You'll have to take another bone test. So you're going to know your bones really well, right? You and Meredith and Emily? Yeah.
I'm beginning to see already how the names of the bones give you instruction of where the bones should go relative to each other.
Okay? So Phoenix is recognized something that hopefully you're all recognizing. A lot of the names make sense because they tell you something about the function of the bone, and they tell you about what the connections of the bone with other things are. And so you can use these to help you learn this anatomy without having to memorize it. So a lot of it just makes sense because of what you're talking about, right? Yeah. And you can see how these things work. Now, there's still 15 minutes left in class, right? 13 minutes left in class. So you think I'm actually going to let you have 13 minutes and not do anything else?
We will study hard for it.
Okay, you can work on your, I forgot, you've got a test next time, don't you? It's not that difficult of a test. Actually, it covers a fair amount of material, doesn't it?
What's the test on?
What is it on?
That's not great.
It's the study guide, yeah. You have a study guide, right, Isaac?
I don't think so.
You don't think
I
so?
was looking for it and I couldn't find it.
Okay, you want a study guide?
Yes, please, that'd be great.
I can give you a study guide.
I'm pretty sure I have it somewhere, but I don't know where it's at.
Okay, and remember that the next to the last page on reactions, we're not doing anything with, right? Don't worry about the next to the last page.
Hey, I'm a pastor for this.
Okay?
College visit.
Okay?
On Monday.
Yes. There's every way that you can on Monday. So, you'll just, what, after school or?
Yeah, after school.
Okay.
Thank you.
What college are you visiting?
Central College in Iowa.
Oh, cool.
Yeah.
For football?
Baseball.
Baseball. Okay. What position do you play?
First baseball.
Okay. Are you pretty positive about the interview, or is it something you're,
Yeah.
is that someplace you want to go, or?
Yeah, that's probably, I'm probably committed to that after this weekend.
Have they already offered you a scholarship?
Yeah, that's a D3, so they can't offer me an athletic scholarship. It's
Okay.
just academic money.
Okay.
Wait, where is it?
We're at in Iowa.
It's a town called Ella.
Okay, what's it close to?
What was it?
What's it close to?
It's like right in the middle.
Oh, is it?
It's like, yeah.
Okay, so you're Des Moines then?
Yeah, it's like half an hour south of Des Moines.
Okay,
Christian,
cool.
is it near Muscatine?
I have no idea.
What school is it?
Central.
I grew up in central Illinois, so I
Oh,
know a little bit about Iowa. I know where Des Moines is. And the Quad Cities.
And see, my mom's from Iowa, so I know.
Oh,
Iowa. Just so you know, Christian, if you go to Iowa, don't let your car go over there.
Yeah.
Later.
Wait, is it the same place that Cam went to?
That's the thing.